intensely with mediastinal nodes. E-bus shows 4R and 7 demonstrates non-necrotizing granulomas without malignant cells. The primary tumor remains intensely FTG. The answer is C, occult lymphoma. The correct answer is A. Okay.
Zil.
Question 1. Which patient characteristic predicts the strongest likelihood of durable response to PD-1 inhibitor monotherapy in non-small cell lung cancer? Your answer is A, which is the correct answer. 17. A 63-year-old man with unresectable stage 3A non-small cell lung cancer is evaluated in the MDT meeting. CT shows a 4-point benefit. Concurrent chemoradiotherapy. Your answer is C, concurrent chemoradiotherapy. That is the correct answer.
These are
From last year?
yeah.
Choose your number. Number 50. A 70-year-old male with advanced non-small cell lung cancer is being evaluated for distant metastasis. Which of the following sites is least commonly involved by pancreas?
C, pancreas.
C, pancreas is the right answer. Question number 42. So this is team from NESCOM. Question number 42. A 50-year-old male non-smoker presents with chest pain and is positive for ALK rearrangement. What is the most appropriate targeted therapy? A. Crizotinib, B. Osimertinib, or C. Pembrolizumab? A. Crizotinib. Your answer is A, very confident, and that is the correct answer. 60-year-old male with newly diagnosed small cell lung cancer presents with acute confusion, nausea, and serum sodium 114. Urine osmolarity is high and serum osmolarity low, consistent with SIADH. What is the most appropriate initial management for this severe symptomatic hyponatremia? A. Fluid restriction, 3. Hypertonic 3% saline infusion, or C. Macrocycline? Your answer is B. And that is the correct answer. 5 is
already done.
Number 5 is done. 25. A 65-year-old male is undergoing EBUS evaluation of station 4L. During the procedure, a large pulsatile structure is visualized posterior to the node. What is the safest next step prior to performing TBNA? A. Perform planned needle epistasis with caution. B. Convert to a 25G needle. Or C. Turn on Doppler to confirm vascular anatomy. 15 seconds to go. B. Your answer is B, to convert to a 25 gauge needle. Correct answer is C.
No.
27. Which imaging modality is most sensitive for detecting early stage lung cancer?
Low dose CT.
That's an easy one. Number 4. A 60-year-old male presents with facial swelling and dyspnea. Imaging reveals a large right lung tumor compressing the sphere vena cava. What is the best initial treatment? A. Radiotherapy, B. Chemotherapy, or C. Surgical resection? B. Radiotherapy. Answer is A. Radiotherapy. Number 35. The 63-year-old female tried non-resolving solidation, now steroid treatment for cryptogenic organizing pneumonia, clinically and radiologically worsening. Bronchoscopy with TBNA biopsy showed atypical cells with following IHC panel: TTF1 positive, CK7 positive, P14 negative. What's the most likely diagnosis? A. Cryptogenic organizing pneumonia, B. Adenocarcinoma, C. Squamous cell carcinoma.
B. Adenocarcinoma.
ठीक है
Your answer is B. Adenocarcinoma. Correct.
50.
The 65-year-old male presents with persistent cough and hemoptysis. CT imaging reveals a mass in the right upper lobe with adjacent rib destruction and FTG avid nodes in the mediastinum. What is the most likely stage of this disease? T3N2N0, T4N2N.
स्टेज बनानी पड़ेगी
B.
Your answer is B. You confident? That is the correct answer. Well done. Please.
Sir, 70.
Number 70. What is the primary purpose of bevacizumab in non-small cell lung cancer treatment? One, inhibit EGFR signaling. B, inhibit VEGF, or inhibit
B. Inhibit VEGF.
It's a very confident answer. Well done. 64-year-old male has a centrally located tumor obstructing the right main bronchus. He undergoes flexible bronchoscopy. Multiple forceps biopsy yield only necrotic debris. Bronchoscopist wishes to examine to maximize the diagnostic yield for viable tissue, which is the best option. A, repeat forceps biopsy using larger forceps. B, cryobiopsy. Or C, radial EBUS with guided sheath.
C.
Just on the cusp. C is your answer. The correct answer is B. It's a central tumor in the bronchus, so you can't do radially. T7. 69. A 58-year-old patient presents with left upper lobe tumor, known N2 disease, and has completed neoadjuvant chemoradiation. PET demonstrates reduced nodal uptake. What is the most appropriate restaging test? A, repeat PET CT in 3 months. B, CT scan and clinical follow-up. Or C, linear EBUS with systemic nodal sampling. Your answer is C, repeat linear EBUS. Yes, C? That is the correct answer. We talked about this earlier in the discussion. 71-year-old woman with a known right lung cancer develops a new PET avid contralateral paratracheal node. EBUS TBNA of station 4L reveals metastatic carcinoma. By TNM classification, how would this finding be staged? N2, N3, or M1A?
B.
B. Your answer is B. N3. That is correct. A 68-year-old male with COPD and limited stage small cell lung cancer has good performance status. What is the best standard of care? A. Concurrent chemoradio. B. Sequential chemoradio. Or C. Surgery alone.
A.
Answer is A, which is the correct answer. Often progressive dyspnea. Lung biopsy is performed and the frozen section histology is shown below. So have a look at the histology.
ठीक
I mean, आप उसका histology देखें. I'll give you option and then we'll come back to this. Okay? So what is the most likely diagnosis? A. Mucinous adenocarcinoma. B. Large cell carcinoma. Or C. Squamous cell carcinoma.
A. Mucinous adenocarcinoma.
Your answer is A. Mucinous adenocarcinoma.
ठीक है.
It is correct. Number 30. 66-year-old male with previously treated non-small cell lung cancer presents with isolated adrenal metastasis confirmed on PET CT. No other disease is detected. What is the answer is A, which is the correct answer.
पहले
B, NESCOM.
Sir, 40.
Number 40. It is an easy one. Hypercalcemia is commonly associated associated with which lung tumor? A. Adenocarcinoma, B. Squamous cell carcinoma, and C. Small cell carcinoma.
B squamous cell carcinoma.
B. Squamous cell carcinoma. 27.
हो गया
27 हो गया.
हो चुका है
27. Number 3. A 63-year-old female with multi-station PET avid nodes is undergoing EBUS TBNA. Operator samples only 4R and 7 because they appear most abnormal. Pathology is negative, but clinical suspicion remains high. Which factor most increases the risk of a false negative result? A. Presence of calcification in nodes. B. Using a 22 gauge needle instead of a 21 gauge needle. And C. Not systemically sampling all mediastinal stations. The answer is A. Correct answer is C. 17.
हो चुका होगा
24. A 62-year-old female presents with shoulder pain radiating to her hand, along with ptosis and meiosis. Imaging reveals a lung apex mass. What is the most likely nerve involvement causing symptoms? A. Cervical sympathetic chain. B. Brachial plexus. C. Long thoracic nerve. Your answer is A. That is the correct answer. Muzaffarabad and Shifa, we are sorry to see you leave the contest.
we can
Well done for trying. So we have now MH, Fauji Foundation, KRL, and NESCOM. Good competition. So question number 8. The 62-year-old shipyard worker with a 30-year smoking history presents for lung cancer risk assessment. He reports long-term exposure to asbestos inhalation and his CT just shows bilateral throat plaques. Which additional occupational exposure has the strongest synergistic effect with smoking in increasing the risk of lung cancer? A. Crystalline silica from shipyard sandblasting. B. Diesel engine exhaust. Or C. Asbestos fibers.
नहीं
C.
Your answer is C. Asbestos fibers. Correct answer.
पास किसने करते अच्छा ये
Which one? 20? 24. Which biomarker best predicts benefit from immune checkpoint inhibitors in non-small cell lung cancer, particularly when PD-L1 expression is low? A. High tumor mutation burden. B. EGFR exon 19 deletion. Or C. ALK rearrangement. Is low.
It's high tumor mutation burden.
Your answer is A, which is the correct answer. 44. A 69-year-old heavy smoker undergoes bronchoscopy for a right hilar mass. Endobronchial biopsy shows a keratinizing malignant cells with strong P40 expression and loss of TTF1. Which molecular alteration is most typically associated with this tumor type? A. MET exon 14 skipping mutation. B. FGFR1 amplification. Or C. ALK rearrangement. Slightly tough one. Your answer is B. Right. Next one.
So 20.
Number 20. A 64-year-old male with metastatic lung adenocarcinoma on pembrolizumab presents with fatigue and weight gain. Lab evaluation reveals elevated TSH and low free T4. Which immune-related adverse effect is most consistent with this presentation? A. Hypothyroidism. B. Nephrotic syndrome. Or C. Painless autoimmune thyroiditis.
E. Hypothyroidism.
That is the correct answer. A 62-year-old patient undergoes radial EBUS for a 1.4 centimeter peripheral nodule. The radial image shows an eccentric view of the lesion. Which interpretation is most accurate? A. The probe is centered within the lesion. B. The probe is averting but not within the lesion. Or C. The lesion is likely benign. C. Your answer is C. Correct answer is B. 20 हो गया 18.
लोग आगे नहीं जा रहे ये सर
That's an easy one. Metropolitan myasthenic syndrome is associated with
वो
A.
सर
Adenocarcinoma and C.
ये सर
B. Squamous cell carcinoma or C. Small cell carcinoma. That is the correct answer. A 68-year-old smoker presents with hemoptysis and dyspnea. PET CT shows a centrally located FDGA with lung mass with enlarged ipsilateral hilar nodes. Bronchoscopic biopsy reveals malignant cells positive for P40 and CK56. What is the most likely diagnosis? A. Small cell carcinoma, B. Squamous cell carcinoma, C. Adenocarcinoma. B. Squamous cell carcinoma. Well done. Let's go on. So 50. 50 is done. 31. 31. 70-year-old man is referred for EBUS guided biopsy molecular profiling. Cell block from the prior EBUS was insufficient for NGS due to scant tumor cells. In order to maximize molecular yield on repeat biopsy, which approach would be preferred? A. Repeat EBUS TBNA with 22 gauge needle. B. Use intranodal cryobiopsy. C. Perform bronchoalveolar lavage. Say A, repeat EVAS, TBNA with 22 gauge needle. Your answer is A. Correct answer is B. Question number 9. It's my lucky number. Okay. 60-year-old man with chronic cough and weight loss is found to have a cavitating mass in the right upper lobe. Histology shows keratin pearls. Which paraneoplastic syndrome is most likely? A. Hypercalcemia due to PTH-RP. B. SIADH. Or C. Cushing syndrome. A. Your answer is A. 1-5. A 67-year-old man with a 45 pound case smoking history presents with a 3.5 centimeter right upper mass. That's A, D, then 4R, 7, 4L, B, 4L, 7, 4R, T, or C, 4R, 4L, 7, then T.
बच्चों को किसी जगह देना पे
4R, 4L, 7 and D.
Correct answer is B. You start with the highest station N3.
यार आगे से हट जाएंगे आप
33. A 42-year-old female presented with 4-week history of wheeze and mild hemoptysis. Chest X-ray revealed right lower lobe collapse, and bronchoscopy showed a cherry red luminal mass. What is the underlying tumor? Answer is C. Very confident that is the correct. Right. NESCOM. 66.
नहीं रोल नंबर
66.
इसका MBBS
55-year-old male smoker presents with a pleural effusion. Thoracocentesis fluid is exudated with high hyaluronic acid content. What is the most likely diagnosis? A. Malignant mesothelioma. B. Adenocarcinoma with pleural spread. Or C. Tuberculosis.
नहीं तो आना चाहिए
No hint, please. 15 seconds to go. So B. Adenocarcinoma with pleural spread. Answer is B. Correct answer is A.
Between MH and Fuji Foundation with 20 marks each. And sorry, but good effort. Team 5 is out of the competition with 10 marks. So like Karen is true and then we have a
Tied
tie.
MH and
MH and Fuji Foundation,
so
2 and 3.
so you'll get one question each.
So serving and
थोड़ा screen से आगे आ जाए, थोड़ा सा आगे। Question number 2. 63-year-old male with COPD presents with persistent cough. Chest CT shows a solid nodule measuring 2 centimeters in the left upper lobe. What is the most appropriate next step? A. CT cardiac biopsy of the nodule. B. Repeat CT in 6 months. Or C. Surgical resection.
A.
Your answer is A, which is the correct answer.
Question number 55.
55.
अब इसको अभी उठा के लेके जा रहे हैं।
A 55-year-old male presents with an enlarged mediastinal node. EBUS cytology shows small cells with necrosis. IC results and amplifies posterior
आसान है।
pneumogram. Answer is C. Correct answer is A. What is the preferred first-line therapy of ALK-rearranged metastatic non-small cell lung cancer according to current evidence? A. Alectinib. B. Crizotinib. C. Ceritinib.
A. Elected.
I think there was some excitement. 49. A 61-year-old smoker with newly detected right hilar lung mass is found to have profound hyponatremia, sodium 1 molecule, during preoperative assessment. Urine sodium is elevated and appears euvolemic. Which paraneoplastic mechanism best explains this finding? A. Ectopic ACTH production. B. Ectopic ADH secretion. Or C. Autoimmune calcium channel. That is the correct answer. 1-3. A 66-year-old woman has a PET avid anterior subaortic station 5 lymph node. EBUS, DPNA, and USD cannot access this node. Confirmation is essential because the finding may change resectability. What is the most appropriate next step? Batch nodal biopsy. B.
C.
Your answer is C. Correct answer is station 5.
नहीं अभी आए ऊपर ही नीचे ना जाए फिर।
सर, हम अपनी लाके
इसमें चेम्बरलेन भी कर सकते हैं।
चैम्बरलेन भी अच्छा है।
68-year-old male with a 2.4 centimeter right upper lobe lung nodule is planned for lobectomy. CT shows no mediastinal lymphadenopathy. Which investigation must be performed before surgery? A. PET CT, B. Bone scan, or C. MRI brain?
ये तो आसान है।
Answer is A, which is the correct answer. 64? 64. A 63-year-old male presents with a 2-month history of fatigue, mild hemoptysis, and unintentional weight loss. Imaging reveals a large hilar mass with mediastinal lymphadenopathy. Biopsy confirms a non-small cell lung cancer. Molecular testing reveals no EGFR mutations, ALK rearrangements, or ROS1 fusions. But PD-L1 expression is 60%. What is the most appropriate first-line treatment? A. Pembro monotherapy. C. Cisplatin-based chemotherapy.
B.
A is your answer. That is the correct answer. If they answer wrong, then it's a tie.
57.
Number 57. MHD is Ibrahim. A 71-year-old man presents with progressive weakness of hand grip and numbness along the medial forearm. CT test shows a right apical lung mass invading the superior sulcus. Which neurological deficit most strongly supports the diagnosis? A. Loss of delta abduction due to axillary nerve involvement.
यानी सर
B.
आसान है।
Weakness of intrinsic head muscles due to lower brachial plexus involvement.
B.
पूरा ही नहीं होती।
That's a very confident answer. That
Yes.
And that means second year in a row, the winning team is from internal medicine. That is big achievement. To present the winner trophy, I would like to invite Dr. Humera and Dr. Turi. Please come and give the winning trophy to the winner.